Hi, I'm Mark Stafford, Clinical Director for Butterfly Effects in North Carolina. We've all been affected by the coronavirus or COVID-19 in the last few weeks, and I would think that children with autism and their families are some of the most affected. You may be wondering whether or not you should talk to your child about the coronavirus, and that's the purpose of this talk now, is to decide whether that's a good thing to talk about, and if so, how to go about doing it. I think that if your child is able to understand the word sick and to say they're sick, know when other people are sick or what that means to say someone is sick, then they probably have enough language skills to be able to have a conversation about COVID-19. For those children who don't have that level of language skills, you may want to just try to set some routines in the home. Your BCBA may be able to help provide you with some activities. Maybe you can expand hours or reduce hours if that's better for your family for ABA services. But I would allow some more time for fun, maybe movement activity with them. You can go outside, and just need to be careful about touching things like the playground. Is probably not a good place because a lot of people handle the playground equipment. Other children that probably don't need a conversation are those who understand what sick is, but they're just don't seem to be affected by it right now. They're calm, they're happy with their time at home, and it's really not necessary with those kids to have a discussion about something that could end up being kind of scary. But if your child is asking questions, certainly those should be answered. Other children that where you might want to talk about the coronavirus is if a child displays behaviors that seem to be indicating an interest or worry about the coronavirus. Maybe they take notice when the adults are talking about what's going on with the coronavirus, or they look at the news and they are attending to those conversations and those news broadcasts. So you may want to approach them, even if they don't ask questions, and say, hey, we need to talk about what's going on here and what this is all about. If you do have that conversation, I think the first thing to keep in mind is to keep it as simple as possible. Use words that they understand, but you will be introducing probably some new words like coronavirus or COVID-19. You may want to explain that those are the same thing. You probably will introduce the word germs, and because that's important for keeping yourself safe. And we'll talk a little bit more about that here in just a second. You also want to do this when you're calm and not at a time when you're feeling nervous about the virus. If you've just been heard some bad news, or you know, for whatever reason you're a little nervous or fearful, it's probably not a good time to be jumping right into a conversation with the kids, because they'll pick up on that and be maybe more fearful, anxious themselves. Likewise, it's not a good idea to have those adult conversations to talk about the coronavirus if you're talking about someone who has the coronavirus, or about the effect that it's having on the state or the community or whatever. We want to talk about it at a time when we can be more reassuring and more positive, and again, not when you're feeling already nervous about things. Avoid having the news on when the kids are around, because it's full of coronavirus stuff and big numbers and people in all this protective gear, and that can be a real scary thing. So I try to stay away from that. We do want to let them know that we need to we need to keep germs away, and that germs are what causes the coronavirus. And maybe they already know a little bit about this, but you know, you might talk more about what germs are. And there's a good video on YouTube that may be available through Butterfly Effects too, but It's a guy goes into a third grade classroom and uses this powder that can be seen in under ultraviolet light, and it imitates the how germs are affected, and it's a I think kids would get a kick out of it, and it's a good way to explain how germs are spread and why it's important to wash your hands. Overall, you want to be really reassuring to kids. You want to let them know that most people aren't going to get sick, that we're going to stay home, and we can't play with our friends right now, and that's not a lot of fun, but that's helping everybody stay healthy and helping them keep from being sick and helping mom and dad from being sick. And that's why we wash our hands. That's why we keep a distance from other people. Also let them know it's okay to be close to mom and dad, and that everybody's been staying safe together, and that by staying home and staying safe together, you're helping to keep yourselves and everybody safe. And I think you can kind of give them an idea of they sort of have a superpower maybe of stopping the coronavirus if they can wash their hands and stay inside, and for a while have to stay away from their friends, but they have a power to help stop the virus, and that may put it in a way that's positive for them. I hope this has been helpful, and I hope that you all stay safe and healthy through this hard time. Take care.